messed around with it with a few patients. I have a little bit better video, I hope, of the new software. So again, you log in, and the website that we have to log into, I keep right up there. And all you do is put your mouse and double click it. It takes you to the login page. At the top of this login page, you just click this and click my name, and it autofills the rest, and click login. And it logs you into the software. This is a patient list of today. Over here is where I was able to choose today. All these were closed, so this right here was public work sites. I clicked it and clicked on today, and that shows the patients of the day. When new patients are added, you have to come over here and hit refresh to get the new list of patients. So then you double click on whatever patient you want, and it will pull up their two images. Now for some reason it doesn't quite make them exactly centered sometimes, or even exactly zoomed in the same. And so what I've had to do sometimes is, right now when you first log in, it's on the zoom function. So I got my cursor here, I hold my left mouse button down and push up with the mouse, and it zooms in like that. Oops, I double clicked it, and so when it double clicks it just takes over the whole screen. You have to double click it again to go back to both pictures. And so here is what it looks like. Then you have to right click it and hold it to drag the picture where you want it. Now as you can see, they're off center, and so what I've been doing, this is kind of a pain, I come up here to the link button and I unlink them, put my cursor into this one, right click and drag it up so that it is more equal. And then I go back and I left click the link button again, and now they are linked again, but looks more like we're used to seeing them. So in this view is where I usually talk about the optic nerve. Slide over, talk about the macula, slide back. So and now to get the red free, you have to come up to here to this icon, red green blend, and you click it, and for some reason it won't link these. So you put the mouse on one side, you hold the left button and push and just pull it down, and it changes to red free, but then you have to go to over here, click and pull down, and it changes to red free. Then you right click again to move it around to show everywhere, and so it will follow. It just doesn't go smoothly. It just, after you unclick, it moves the second page, second screen, I guess. Alright, so then you're back to here. It's hard to get it to go back to normal. The way they always say to go back to normal is to come back up to here and just click the reset button. When you reset it, it goes back to the way it was to begin with. Now I'll talk about looking for retinal detachments and retinal tears. If one of them is a little bit zoomed, not as good, again I come up here, I click on the zoom feature, and sometimes it unlinks them automatically, so I guess it's, whenever I clicked on that, it unlinked them. Now I can left click and pull that up to make it so it's a little bit better, and then do the same thing here just to say now we're looking at the periphery. Then to go back to look at the choroid level, we come here, click the red-green icon. This time we hold the left button and push up, and we get the choroid level there. And then to go back to normal, we click on the reset to go back to the way it was to begin with. And then lastly, for the 3D, that doesn't do any kind of animation anymore. What it does is you have to go to this icon that says View. You go down to 3D Warp here, and it will only do one at a time until you double click it. Now I double click it and it lets it take over the screen. Now to rotate it, you have to come back over to here and click on rotate, and then you hold the left button, and then you can rotate it around to give them perspective. It's a little more intensive, unfortunately. It gets the job done. When you're done, you just come back up here and click on the patient icon, and it goes back to the patient list. And again, hit refresh if there was somebody that had done an optomap that was new since last time that you had checked it. It will log out after about half an hour, where we have to log back in. In order to minimize it, you can just minimize it right here, and it actually will be the Internet Explorer there, where that can make it go away or come back, the Internet Explorer. If you have to log out, it just makes you log back in where you click my name, and it logs in automatically.